I am glad to see you guys. I have so much to share with you regarding your troubles that you've been having with your health plan and us going forward with some of the information you've been sharing with us having to do with the city council and our legislation. And so there's a lot to catch up on. First, Amy's here. Thank you, Amy. So I want to thank Amy, first of all. Amy was such a major help to us in bringing us information as to what teachers, retired teachers, active teachers are going through as well. Because look, there's a lot of people, you've been hearing us talk about the problems we've been having with the health plan, with the drug plan specifically, this transition. You guys have been lighting up our phone over the enrollment and the using the app and using the portal. So today, Amy and I were on a phone call with OLR and Emblem. And it was, I would say, it was fantastic. I want you to know they hear you. They definitely hear you. And they want to fix the problems that you're having. So I was hoping to be here 10 minutes earlier, but like I said, Jules had surgery and I had to run and get her medication because they're closed all weekend. But we're here and to kind of recap what happened today. So my thanks to Amy for being my partner on this call and helping bring the information to them that not even they heard from anywhere else through the last 16 days of this rollout. So your message is getting across. They hear you and they want to make sure that they're fixing the problems. We're going to keep that link open that says, hey, are you still having a problem with your drug plan? Are you still having problems? What are the problems? Please let us know, because in real time, we're able to now communicate with those official people to help you fix these issues that they were unaware of and all that you've not been able to get fixed by going through the normal channels of what you've been normally doing. So first, I want to say thank you to Amy, and everyone here should say thank you, Amy, for bringing in some of the things that she sees on the teacher pages that I don't have access to. And then the rest of you guys, whether you're managerial, your CSA, your COBA, and some of the teacher peoples as well, for sharing with that to us. So first and foremost, I want to say that this was also something that should have been debunked from the beginning, and it hasn't. Many of you contacted us and say, I hate Amazon Prime. I don't want to use Prime. So today they told us specifically that Amazon Prime is not Prime Therapeutics. Prime Therapeutics is its own company. Amazon Prime is another company, and they're not related. The only thing that they have in common is they share one of the words, Prime, but they're not the same. They're not even related. So Prime Therapeutics is your pharmacy benefit manager. They're like the drug dealer and they need someone to get you the drug. Amazon Prime is the delivery, and that's all they are. Okay. Another question came up. Do I have to create a Prime account? No, you don't. If you're not interested in mail order, if you're not interested in price shopping your drug, which is another issue I'll get to in a second, then you really don't need a Prime account. They're telling you that they hope that maybe one day you be able to get into it comfortably because they want you to be able to look at drug pricing. They know drug pricing is an issue on their different portals, as Anne and several of you have told us, that you're seeing different pricing no matter which way you go, whether it's on the portal, through Emblem, through the app, through the website. If you are one of those people that is price shopping a drug, I would like an email from you, if possible, telling me that you've shopped the drug on the app or across the portal or whatever, and that you're getting like 14 different prices. I want to see, and then if you can send me screenshots, like screenshot here what it's through Express Scripts, screenshot here what it's through Amazon, screenshot here, what you're, and it's the search. Let's say you're searching for the same drug, the same dosage, and just the location of how it's being of where you're getting it from is what's costing you differently. Show me those, because they're interested to seeing that, because a handful of you keep telling us that you're seeing this happen and then you're frustrated with the portal not giving you this correct information, right? So that's the drugs issue. Emblem put up an FAQ, and let me see if I still have that open on my million screens here. That's one here. So on this page, and it probably, is this the right page? Nope, not that page. This page. This page? Give me 1 second. I want to go to the right page because I have the same one open twice. Okay. Now, let me, senior care FAQ. Okay, let's go to this one. There's a couple of links I'm going to drop in the chat, and I'm probably going to put them in an email maybe on Monday for you, because there's some things that are going to change. This website right here that I'm sharing with you right now, and let me do a shared screen so you see what I see. This is the one I shared with you guys the other day, and it does show the 4 boxes on the screen. You see that? Key details, and you'll see it'll say quick start. Let me scroll this down just a little. Senior care quick start, pharmacy FAQs, and this tells you all plans except the NICE PPO. Here's the senior care video. Go and check these out, everyone. They're going to come up with more. We talked about doing more videos today to help you understand and to help you be able to get into some of this, to do some of these things, like if you really did want to create the portal or do some of that, right? That you might need a little bit more hand holding. They hear you, and they were very apologetic with the problems that you've been having. So this was their way of trying to see if they could mitigate some of those issues that you were having. So this page here, this is for senior care, pharmacy FAQs, also your senior care video. Here on this side, you can log into the My Emblem portal. This was the next point I want to make to you, is that you know that you can go into NICE PP. I'm sorry, you can go into creating an account through Prime Therapeutics, or you can go through a single login through Emblem Portal and create the account. What you were finding that was if you did one and you struggled and you got it done, like going through Prime, but then you tried the easier route by doing the single logon, getting your pharmacy through My Emblem Portal, and then you went back and you successfully did that. Then you went back to the first way you had done it. You were locked out, or it told you you didn't have an account, or you weren't having coverage anymore. They're going to fix that. And this time, though, before they roll that out, they want to make sure that the fix is truly fixed, right? So they want to make sure that that it is working before you try it. They told us it should be fixed by Monday, but don't be surprised if it's fixed sooner. So if you find it works, great. If not, don't worry. Give it till Monday. Monday is like, it should definitely be working Monday, but don't be surprised if it happens to be working, sooner than that. So some of these videos are like 5 minutes long. I'm going to create a short. So it's just a short, like little 5-minute thing for you, just based on that. I know some of you aren't figuring out the right website. You're not finding the links that we're sending you, but you always seem to find us. And then, of course, we share our videos with you on all of our platforms and in the emails that we send out. So I want you to know that that's going to maybe help you understand a little bit more of this. And they're trying to make it easy. So the fix should definitely be done by Monday, but don't be surprised if it happens sooner. They are addressing your issues, and many of you have reached out to us on our survey, and as well as reached out to OLR or Emblem, and telling them the problems that you're having, and they are addressing them. Some of you have contacted us already and posted with gratitude to Emblem for the things that they did fix, and we're happy that worked out for you. But they want to stay in touch with you so that you do know that they are paying attention, right? I believe them when they say that they do want to fix this. I really do believe them. They were very interested in the things that we had to say to them. And like I said to you, they hear you. They heard a lot of what you've been saying to them and your messaging. Chris, great to see you here. And we did share your messaging with them as well. They hear that. They hear that. They also know that's an issue. So one of the things that we're identifying for you nice PPO people is that your little card says the top has emblem logo, and it also has the United logo. And you're going to the doctors and they said, oh, we don't take that plan. We don't take nice PPO. We don't know what that is. Or, oh, that's emblem. We don't take emblem. But they're not running the plan. They're not realizing that for you people that are outside the downstate 13, that you're in the United Healthcare Choice Plus network. So we've encouraged them to create another little card that you can print off the portal or print off the app. And they're actually going to send you a letter. They're going to tell you in a letter with the FAQs about the login. They're going to give you their apology of how this was rolled out. And they knew that they'd have hiccups because it's new. But today, Amy and I had a wonderful conversation with OLR and Emblem, and it was fantastic that they understood some of the issues. They were fixing some of them. Some of them were already fixed, and some of them they first heard from us for the first time that they'd never heard before, and that they will get back to us on those. So I want to thank you guys for having that patience and allowing us to try to mitigate them for you. It does help that you come through like one place, and if you weren't getting the answer to wherever you were going before, that they were getting fixed once you came to us and we were funneling them to where they had to go. But it's important that you guys stay calm and understand that. John Luke, my wife tried to fill her script for Tremfya, which Prime Therapeutic, that it would cost her $17,000. This was covered by her insurance 100%. So, Jean-Luc, I do not know the situation around this. I don't know if you're Medicare, you're not Medicare, you're nice PPO. You need to give me more information. So if you could do me a favor, email us, whether you're in a union drug plan, you're in the city drug plan, you're Medicare, pre-Medicare, and tell us exactly, because if you're pre-Medicare and this is like a drug that might be an injectable, or it might be, and I don't know what it is, there might be another reason why it's not being covered, or it just it takes us just a little bit of maybe inquiring as to why this is failing. If it was covered by her insurance before, it's probably not being processed correctly, because that was another thing that they told us. Just give me 1 second. I want to put in the chat our email link again. It's retirees@nycretirees.org. I need you to send that information with your contact and your wife's name, please, to our email address. And then even though it's Friday night and even though it's a weekend, don't worry, send that to me tonight. I will make sure it gets passed along, and hopefully you have an answer. And then let me know when she needs to have it, when she definitely needs it filled, so that we make sure that she gets it in time. Okay. But thank you for that. Let's see. There was another comment here. Many things have been fixed, as you said. Others still require fixing. I spent over an hour on the phone with Prime yesterday. The agent was very helpful. So, Carrie, yes. Again, if they're not able to fix it or that's not getting fixed, please let us know, because we do now have that that connection. Janet, Tremfya is a specialty medication. So that might need to go then through another process for a specialty drug. That's going through, I believe, we had another lady, another lady that had that same issue. She's on here right now too, specialty medication, and it had to go through Accredo. which had to go through Emblem. So you may want to call Emblem as well, but give it to me because it's already after 5. Send the email to the org and I'll handle that for you. Just make sure the details, the contact name and number, and your wife's info, the drugs are on that email, and I'll handle that for you. 4 times I waited for OLR over an hour, got disconnected. They don't answer. But trust me, there's like a million of you calling OLR. They just don't have the staff to do it. But send it to us. Send it to us. What website do I use to set up an account for Prime Therapeutics? I tried a few times and they were wrong. So Deborah, I want you all to try going through what we said the last time. We put out that link. I'm going to drop it in the chat again. This will tell you how to create the account going through Emblem. Look below. I'm just posting it now. You are on Facebook, so it should be coming up on Facebook. It should be coming up. Oop, it's not going to Facebook. Hold on. Let me make sure it actually lands in Facebook. Okay, it landed that time. So you should see a link to Emblem's website. And if you go into that first box here, it'll tell you Senior Care Quick Start Pharmacy FAQ. See that? And then the second box is the Senior Care video on how to start your account. It says learn to get the most of your 2026 pharmacy benefits with our portals. You do not need to use the portal or the mobile app to fill your medications. And that's if you don't want to use mail order, but follow these instructions because this will help you. So that's where you're going to go. Prescription was filled for 91 cents. While laptop said 30, app said $91, sent in complaint. Representative said, don't go by prices. No. So Anne, I need you to do this for me. When you go in, I want, you said the prescription was filled for 91 cents. On your laptop, take a picture of your screen showing me $30. Then you said the app said $91. Take a screenshot using your screen showing me the $91. Then send me that in an email, those 2 photos, and then tell me that you spent 91 cents at the pharmacy itself. Send me those with your contact info. They want to see this. They need to know who you are, where you live, what your drug is, and then see how you did. They want to try to reproduce what you're showing them so they could fix it. Okay. So hopefully that helps you. I live in Florida and I had the same issue regarding accepting NICE PPO. It took a while, but when I told them the new plan uses the United Healthcare Choice Network, works fine now. Thanks, Marion. So I am so glad, Raul, because this is they designed that card piss poor. I mean, there's really no other way to say that. It is really a shitty design that they didn't say like United Health, this plan uses the United Healthcare Choice Plus Network. And they kept wanting to say NICE PPO, which also bothers me. And I didn't say that to them today, but I don't like that the plan is called NICE PPO. I was like, what the hell does that mean? And it means New York City Employees PPO plan. Well, if you're retired, you're not an employee. And they should have come up with something better than that. And that's really shitty. But I'm going to tell you this. I think they finally understand that they have to listen to retirees. We ran this city and we fixed shit. So we understand what they don't. And I think they're finally starting to learn that. If the date of service was in 2025 and the bill arrived and was paid in 26, can be so Anne, I know nothing about SHIP, and sadly you're going to have to call the United Federation of Teachers on that if you're UFT SHIP, because that's not us, and I can't really tell you anything about it because I don't know that plan. So if there's other UFT people here that can answer that question, go right ahead. I can't. I apologize, Anne. I don't know that answer. But I will let them defer to them for those answers. I agree. This card is made like crap. Yeah. So what I said to them was maybe we do a card that could be printed up in your portal that says like, dear provider, this NICE PPO is using the United Healthcare Choice Plus Plan Network. You're in United. If you accept United Healthcare Choice Plus, and you're a participating provider. So there's something there for you to look at. Ellen, if a patient needs a drug that is not in the Prime formulary, it requires that the doctor fill out form, faxed to Prime Therapeutics and returned, otherwise the form will expire. Okay, so we also talked about prior authorization. Amy brought up a very valid point today in that many of you are concerned about Prime Therapeutics and your prior authorization. So what they said to us was the prior authorization process is not a process that you have to do. They're letting you know about it, but you don't do it. It's done between your doctor and the pharmacy. So they want you to know that that's the process that's happening, but especially for the Medicare people, they're calling you to let you know that that process has been done and that it's been approved and that your drug is coming. So they're trying to communicate with you. They're also going to communicate with you whether you're Medicare or not Medicare is if they're doing that automated process with the doctor and the pharmacy to try to get the prior authorization done, get the information that they need from the doctor. If they're not getting it, they're going to send you a message that says, we've tried to get this done through your physician and they're not responding. Please give them a call. That means they need your help to nudge the doctor's office to give them the information that they need in order to get your drug approved. Now, I've had that done a couple times to me, and I'm not in this plan, but I need you to know you may get a call like that. But this is not a process that you, the retiree or the employee, has to worry about. This is not to be done by you. This is supposed to be done by them, the doctor and the pharmacy. Now, they're letting you know that because typically these prior authorizations will be done in an automated process, but they're letting you know that when's the expiration or if it's not valid, it's going to be needed. Like they want you to know the process, but that's not something for you to complete. Okay. We also thought, Amy had asked if there was a way to see what drugs require a prior authorization, because many of you are saying, I never needed prior authorization on my medication. And what they're telling us is you probably didn't know that your drug in the past needed a prior auth. It was if they have a prior auth today, they had a prior auth under Express Scripts when they were the drug manager. So they want you to know that this process was happening. You probably just didn't know about it. So they don't want you to freak out about that, but they just wanted you aware for transparency that this drug does require that. Now, we are going to share with you their formulary because they're on our website. I will update those links if they're not accurate as of tonight. But they gave us the formulary, and on the formulary, you will see a little letter PA. If you see a PA, and I'm going to try to go through that entire formulary and highlight that, then you will see PA wherever you see PA that requires a prior authorization. That lets you know that that drug requires it, but you don't have to do it. It's just letting you know that that drug, for whatever reason, whether it's quantity or dosage or the drug itself, requires a prior authorization. Okay. But that is in the formulary so that you guys can look that up and see that's why your drug the doctor is being asked to get a prior auth for that. Prime said prior auth is not the same as a formulary exception, which is what I need. So then that means that your drug is not in the formulary at all. Okay. Prime told me I need to alert the doctor about the 72-hour deadline. Very good. That's good to know. Chucky Diaz, hi from Cape Coral, and thank you. And you're welcome. It was good talking to you earlier. And I sent screenshots showing the price differences from both Prime and the organization on Tuesday. Told me my complaint will be addressed when they can. And I will go back to that. Bob, who's been doing that, had cataract surgery today, so he probably wasn't in the email, but I will go back and look at myself. But thank you for letting me know. On the right-hand side of the formulary spreadsheet. Yeah, so let me see if I could pull that up while I'm in here. And show you what that means. So let me come back to you. I want to share another screen. Whoops. share screen. And I want to do formulary. Okay. I'm going to put this on the screen now so you can see it. Here's the formulary. And if we scroll down, you'll see prior authorization is PA. This plan requires you or your doctor get prior approval for you to fill this prescription, right? That gives you some of the codes that you're going to see. QL is quantity limit. So they give you some of the abbreviations here. So you see what you're looking at. ACA is an Affordable Care Act drug. LA, limited availability. ST, step therapy, right? So if we scroll down to where the drugs are, right here, you'll see some of those. You'll see this Arikase, whatever that is. It is LA, limited availability, prior authorization, quantity limit. You see that? We scroll down a little bit more. Here's more Noxafil, prior auth here. I'm not going to name all these because I'm not going to butcher these words online. But these are all requiring prior auth. So you see that? You see the letters right here that these require prior authorization, right? That's to tell you that's what we're talking about. So Amy had brought that up because she thought it would be really helpful for you to see this information, to be able to search your medications in real time, instead of, waiting for someone to ask you about that. That's why it's really important that you can see, to see what medications that you may have. If you have any problems, I'm going to drop that link again into the chat for our survey. If you're having drug plan issues that still need to be addressed, okay? We put it in the newsletter yesterday, and you should all have gotten our newsletter. If you didn't get our newsletter, please sign up for them. It's the same link, nycretirees.org. That way you can go right to our website. It brings you right to our website. There's the tabs at the top. You can sign up for our website emails. You can sign up for our emails. You can make a donation. You can do everything right there in one spot. So please keep yourself informed. I mean, we really work very hard on doing this, and we do this. Like, I run the website. I'm the one that does the updating of the web page, and then our team goes through the emails, and our bookkeeper tracks all of our, and treasurer tracks all of our donations. Senator sponsored the bill. I said, thank you, Judy. So we are doing another bill in the Senate and the state, in the state and the city. They are both being finalized, and we will let you know when they're coming back, because we are planning a trip. I did tell you, keep March 17th on your calendars. March 17th, please book, because we want to make sure that on our event that day, you're spending all day with me again, all day. That it's St. Patrick's Day, yes, but we're going on this trip, and you're coming with me, and we're probably going to try to take 100 of you. So keep March 17th. We'll throw our own St. Patty's party, but March 17th is our day. Laura, not trying to belittle any well-meaning emblem rep, but some could really use some training from you. Like the fact that one rep thought Medicare invalidated the 365 hospital day rider. Thanks for clearing up your concern. I appreciate you sharing that with me. I did not bring that up, but I will. Just letting you know. St. Patrick would approve. Yeah, Amy, I wish, if you're here in March, plan to take that trip with us. We are taking a trip. I'll fill you in later, but we are all day, absolutely all day. So who's the sponsor on our New York State Assembly bill? It is still going to be Stacey Pfeffer Amato. It is her last year. And I am not announcing who the state Senate sponsor is until that person has the bill introduced. I'm not jinxing anything. Shh, Judy, don't tell. So as soon as it's done, and then we'll announce it, and then we're going to party. We've got a lot of work to do then to make sure that we get that bill passed this year, as well as 1096. which is also coming back with Councilmember Marte. On Express Scripts, I got 3 months name brand Synthroid for $12. Now, 3 months will cost me $150 at Amazon. So, Deborah, do me a favor. I want to see a screenshot of this because I need to know if you're going through Express Scripts. Well, first of all, I need to know if you're Medicare, pre-Medicare. So always when you're emailing us, I need to know that because that makes a difference. We also talked to them today about Express Scripts and Amazon Prime delivery. So again, for those that are just joining us because the numbers keep ticking up, I want you to know Prime Therapeutics has nothing to do with Amazon Prime delivery. They're not even related. Yes, they do share a word in the name, but they're not connected whatsoever. Prime Therapeutics is your pharmacy benefit manager. They're the ones that make the deals with the pharmaceutical providers to buy the drugs, to sell them to you through the retail outlets. So the delivery, if you're Medicare and you have access to Express Scripts or Amazon Prime for delivery, if you are pre-Medicare or active, you no longer have access to Express Scripts. Your mail order delivery is only Prime, Amazon Prime. So I need you to be able to tell me what you are, Medicare, pre-Medicare. Please give me the drug and the dosage. Give me a screenshot from Express Scripts if you just got them, that your 3-month supply was $12.50. Now I need to know see the screenshot for Amazon, $150, and send that to our email address, Deborah, and I will address that. Wondering who's chairing the committee. So we don't know what committee it's going to go into, so we'll have to wait. Pre-Medicare. So put that in an email to me, please, if you can. Send me the screenshots. That will help me tremendously. Synthroid had the same issue. You can get Synthroid, non-generic from Eagle Pharmacy, Synthroid 90 days, $70. Again, send me the screenshots so that I can see what you were paying or what the different prices. If you're in the app and you're looking that if you're pre-Medicare, you know the only mail order that you can get is through Express Scripts. I need to see what the price is there. I'm sorry, if you're pre-Medicare, the only mail delivery that you can get is through Amazon. I need to see the price that's coming up on your portal or your app or whatever from Amazon. And I need to see if you're looking at a retail local, what you're getting it for. Also tell me what you were getting. If you know what you were getting it for at Express Scripts, show me a receipt for that. Send me all of those in screenshots or put it in an email if you don't have pictures. And let me try to deal with that next week. Okay. Don't go telling me all your drugs here. I'm not going to know the difference of what you're paying. It's just, I'm not, this is the format. Email us at the org. Tell us your name, your contact. Tell me Medicare, pre-Medicare or active. And tell me the drug and the dosage. And then I need to see pictures of the pricing, or you can tell me in the email what pricing you were paid or what you're seeing being quoted to you on the app or whatever. Okay. I'm active with Express Scripts. My card doesn't say Pika, but I called Prime. They couldn't tell me a price because it goes through medical. That's medical number 2, pre-Medicare. And so, Marianne, they acknowledged that we even stumped them with that issue. They were not prepared to handle that. And they're working on that one because you're not alone. Okay. But thank you for letting us help you and trusting us to help you with that work. And thank you, Judith, for bringing that to my attention. This is why this takes a village. You had Marianne, who I knew, who was recently retired from 237 DC 37, and then Judith, who's our one of our moderators, pointed me that Marianne was having a struggle, and then immediately put us in touch again, and we were able to get it fixed, hopefully today. Madeline, I'm Medicare retired, getting my scripts through Express Scripts. What about dependents, college age? Can they get their scripts at a local drugstore? Yes, absolutely. That's the purpose. If they're dependents and they're pre-Medicare, if they're pre-Medicare or Medicare, it doesn't really matter. You can still get your drugs locally, or you can get them by Express Scripts or Amazon delivery. That is up to you. You could have some come each different way. It doesn't really matter. The choice is yours. But that's also the benefit of the portal, is that you can do that. 72 hours for a doctor to respond to a prime therapeutic exception is unreasonable. My forms will expire over the weekend when the doctor's office is closed. Ellen, can you write that in an email to me, please? Because I'm not going to be able to take that like this. If you can shoot me a quick email on that, send it to the org, and I'll make sure that gets funneled up. I was not catching that that's the issue when you wrote it. I actually thought that that was a quick thing, quick turnaround, but the way you're telling me is it's going to expire and they're not having a chance to address it. So please email me that. No, still did not hear anything. I text Carol from Emma. Okay. So just keep me posted on that. They are definitely aware, because when I spoke to them again this afternoon, they were aware of that, of your specific issue. We did discuss this. But don't worry. I will let them know, my point person, that you're still waiting. Can't wait to support the new state bill. Yay, Mary. And I hope both Amy's in town and former council member Holden. That would be great, right? I think we could all have a little reunion together. And see, and this is why we keep saying it does take a village, because all of us together were able to put all of this information in the hands of the people that actually make these decisions or think they know everything, and they didn't. Even with the union leaders trying to, help them mitigate their issues, they still never heard of what we're going through. They didn't even know that some of you were getting your Amazon delivery packages, your Amazon drugs, your drugs delivered by Amazon Prime, that they were thrown in the lobby of your building, like they weren't put in a secured place. That blew their mind when we told them that. They were like, wait a minute, what do you mean? Like they just threw the Amazon? Yes, they just threw the Amazon packages on the floor of your building. So that was incredulous to them. They could not understand that. Can you answer this question at this time? I noticed that our new bills have been reintroduced. No, they haven't. Our new bills are not introduced in the state. Not yet. You're looking at an old bill that belongs to someone else that is not our legislation. Our bills have not been introduced. No. No, not our bill, my dear. We do have some revisions into our state bills. Our bills have not been. When do you know me to not tell you something happened? No, you guys are looking at the wrong legislation. That's not our bill. The Lanza bill is not our bill. Just came on. Did I miss any big news? Copay case. Nope, not settled yet. Thank you for giving us the information we need on our new drug plan. Hope Jules is doing okay. Yeah, Jules cost me more than my own health care. Jules, my poor baby, sitting here, went to go get her teeth cleaned, and they had to pull out 9 teeth. So poor little baby. And then they put her on antibiotics, and boy, her tummy didn't like that. So I had to run and go. You want to talk about getting medication to help her with that problem, so she wasn't miserable all weekend? That's why I was late. I had to take care of her first. She's my baby. Your past Monday's radio show was riveting. Well, thank you, Laura. Did anything come about with the audit? Nope, nothing came about. Nothing yet. I hope you have a better dental plan for Jules than the UFA, illegally allowed city to contribute less to the welfare funds. I don't. Tommy, are you telling me that the union allowed the city to give it less money to keep into your dental welfare fund? That's just wrong. Oh my God. I don't know. Are maintenance drugs for pre-Medicare retirees only mail order through Prime? If your mail order is, if you're looking for mail order, your pre-Medicare, your only delivery mechanism pre-Medicare is through Amazon Prime. When we were on Express Scripts, after 2 fills at a retail pharmacy, you have to transition to mail order to use Walgreens. Laura, if you can send that question to me with the exact drug you're talking about in an email, I will ask, because I don't have an answer for you on that. How do you feel about the new city council president? Do you think she's sympathetic to our cause? So we've had one meeting with her already. We've scheduled another one. So hang tight. Pumpkin is usually good for our fur. Oh, I'll have to try that. I do have some canned pumpkin. Maybe she'll like that. Who knows? Mark Levine scares me, has yet to say he's read the audit of the stabilization fund or say, and we're working on a meeting with him as well. He needs to have some education. But that's basically, I think, all I had today. You will be getting a letter from OLR, but first they are going to let us eyeball it so that we can see if there's something missing, or to kind of judge that you'll understand, put it in a way that it's easy to understand. We talked about the Express Scripts. We talked about Amazon and Prime Therapeutics not being related to Amazon Prime. I will be sharing with you the full formulary. It is currently on our website. So if you go to our website right now, nycretirees.org, you can see it's the same links that have been up there. I do just want to check that those links are up to date. And you can see that your drug requires prior auth. Remember, that's not something you do. It's between the doctor and the pharmacy. They are fixing that login issue, that whether you go through Prime or you go through the Emblem portal, it was blocking you from doing one. It was either one or the other. They've actually programmed a fix for that now it can be either or. It doesn't matter. You could be both. It doesn't matter which way. It will recognize you no matter which way. And they are saying that it should be fixed by Monday. Most likely it'll be fixed sometime over the weekend. So don't be surprised if it is, if you try it. If not, please check back on Monday. If you're still having a problem, let us know. Some of the most popular medications, like your GLP-1s, like your Ozempic or your Mounjaro, those have to have prior authorization. Unless you're diabetic and they know that you're diabetic, the prior authorization is being done by the doctor, but specifically because there are people that were using those medications and they're pricey that do not have diabetes, so they want to know what the drug is used for. Also, people on glucose monitors, they did have to change vendors, and they're only for people who have diabetes. There's some crazy people out there that want to keep track of their blood sugar for some crazy reason, and they're not diabetic, and they won't be covered. So that's why they have prior authorization on those. And I think that was basically it. So let me take a quick check here and see if you guys have any questions. Let me check on the other side of Instagram, since Instagram never lets me see what's going on. Thank you so much for keeping us to date. You're welcome. Yes, take care of my baby. Is there a quick formulary for diabetics to give to our doctors? So if you're, and that depends on Save B, Cliff Loss, whatever that is. If you are looking for the formulary, I need to know whether you're pre-Medicare or Medicare. If you go to our website, I'm going to put the link there for right now because I'm going to be updating these. So I'm going to give you a couple of links in the Instagram right now if you're still on there. So this is our page with the NYC EPPO plan. Here, this is if you're Medicare. Let me come back to Instagram. This is the formulary page if you're Medicare. And on this page is if you are pre-Medicare. Okay, so those three links went into the Instagram feed. Let's see. Facility fees, what are you looking to document? So, Matt, I don't think I'm looking for anything quite yet. Let me get back to you next week on that. Screen sharing. No, Deborah, I wasn't screen sharing. I was actually posting into Instagram. So we're broadcasting right now into Facebook, LinkedIn, YouTube, Twitter, and Instagram. I can see most of the comments from you guys in here, but for some reason, Instagram will not talk to my platform here. I have to literally switch between talking to you and then Instagram. So, but because there are people who are not on Facebook or Twitter or whatever, I want to be able to reach as many people as I can. I have to keep flipping back and forth. Nancy, I am still diabetic and still need prior auth to get it. And yes, you do still need prior authorization, but you're not doing it. They just need to know from the doctor that you are diabetic, and that is one of the criteria to approve those medications. Yes, that is why I got Express Scripts. It goes through USPS rather than UPS. Thank you. Yes, and we brought that to them. They were unaware that Amazon Pharmaceutical is not put in a secured mailbox. So for those of you guys that live in an apartment building, it is literally tossed in your lobby. They were unaware of that, and that was crazy to them. Credo says Prolia is covered. $500.36. Someone said Prime doesn't offer it. What's the story? So, Steve, I am not able to tell you that. You need to check the formulary that I dropped in the chat and see if your drug is covered. Now, if you are, again, making me do this 3 million times, if you are Medicare, your formulary is in this link. Let's make sure that goes through. And if you are on the NYC EPPO plan, your formulary is in that link. And if you don't see your drug there, or you're still having pricing issues, then fill out the survey that I posted earlier. Hold on, let me go back to that. And you can put your information here. And I'll put that over in Instagram as well. If you're having trouble with your drug plan that offered by the city, you can put it in the survey and we will address it. And yeah, okay. You missed my question. What's your question, James? I'll wait and watch. Retype your question. I'll take a quick look. But I just need you to know, like, they fly by like really fast. And if I'm multitasking, I'm not going to see it. And I'm not, oh, here it is. How do I find out more? How do I find out more about how much to pay for drugs? As in December, I paid $15 for a drug and now I had to pay $700. What? So James, again, you need to check the formulary to make sure your drug is in the formulary. I don't know if you're Medicare or pre-Medicare. That's actually really important, and I can't answer that question without knowing that. And then you need to check the formulary. If you were paid one price for a drug in December, I think you said, that was last year. So this year, you're also paying, remember, it's a new year. So let me go back to that question. Yeah, December. So if you paid for a drug in December and you paid $15, you've already met probably the maximum out-of-pocket cap. If you're Medicare, your cap is $2,100. So of course, then there would probably be minimal cost, if any cost at all. If you're Medicare, I don't know what you are, but now you also have a deductible, and you probably have a deductible, but you definitely have a out-of-pocket maximum. And if you haven't hit that, since we're still in January, I'm assuming you haven't, you're paying, if you're on this plan, 25% of the cost of that drug right now. That's probably why you're paying more, and that's probably the easier answer. But I'm not seeing anything else from you, so I'm thinking that might have answered your question. Made a Prime account, it went poof. Can't get into the account or app. My $10 generic no longer covered. They have a substitute which looks the same, but nobody tells me the difference. So Susan, again, this fix of logging in, because you can let me suggest, did you create a Prime account, then you created a single login account, you logged in through Emblem's portal. If you did that, it blocked your ability to get into Prime. If you're having that problem and it's saying your drugs are no longer covered, that is exactly the issue that I've been explaining in this live. Okay. Please check again on Saturday, check again on Sunday. And then if not, you're still not seeing any difference, check again on Monday. Monday is the day they're telling me that this issue should be fixed. If by Monday it is not fixed, please message me. So that way I can address it. Okay. Let's see what's next. I take Dupixent. It no longer goes through Accredo. It goes through Synexus now. For non-formulary Medicare, the Emblem Therapeutics, can one pay out of pocket and have that expensive accrue? So what I'm told is if it's not covered under the formulary, it is not covered in the maximum out of pocket. Missed your formulary as we just came back. So Steve, go back and look at the chat. You're on Facebook. Look through the Facebook comments. It will come there. Again, I don't know if you are non-Medicare or Medicare, and that makes a big difference. You can always go to our website, nycretirees.org, go to the NYC EPPO page and go look. I actually have the links that we posted in January or December that are still there. I will update those links tonight to make sure that they are the same, but you can check the formulary there. One plus about delivery from Express Scripts is that it comes to your locked post box. Yes, that's what we told them today. If you're in an apartment building or condo complex with Amazon, porch pirates might get it first. And that was foreign to them. They did not understand that that could actually happen. They didn't know how it got delivered. It was just shocking. But hey, they learned. Prolia goes through Part B. Prolia goes through Part B. Okay, I'm still not. Susan, I have to understand, my brain is moving 10 miles a minute. Now I don't understand if I was answering something that answered that question or that statement. So, sorry. My brain is fried. What OLR letter? Glad it is, whatever it is, glad that, yes. So OLR will be sending all of you a letter telling you about all these things that are happening, the problems, the rollout, the fixes. They hear you. They want to help you. They want to make sure that all of these things get addressed. And so they will be sending a letter addressing this, because I told them today, we're retired, most of us. We don't check their website. We don't, well, it's on our website. I said, that's great. Most of it, I'm retired 20 years. I don't look at the OLR website if I didn't have to. If you didn't try to take my healthcare away 2021, I would never be looking at the OLR website. I didn't need to. So I said, you literally have to kind of guide us to you. Like, tell me I have to look at you. Otherwise, I don't look at the NYCERS website. I don't look at the OLR website. I wasn't even on social media. I was under a fake name, trying to stay hidden from everybody. This was being this person wasn't in the cards. I was playing with my dog and in my garden and fixing Volkswagens. We did not just, I didn't wake up one day and go, oh, let me look what's on the OLR website today. No, no one thinks about that. Emblem told me I had no deductible. Then you have no deductible. So there's people who are confusing the maximum out of pocket as a deductible. It's not a deductible. It's a maximum out of pocket. And on this plan, you'll pay 25% of your medication, cost of your medication, until you hit that deductible. So let's see. And that's another thing, Steve. In this letter and in the FAQs, they're going to explain what has to be done in the prior authorization process, especially if you have to go through a specialty pharmacy like an Accredo to get your medication. We asked them to do that so so people understand the process. They hear you that this is an issue. We literally were dealing with this since 7 o'clock, 6:30 to 7 o'clock this morning on this exact issue with another member with another drug. Roberta, here's another issue. I will be calling you this week because we also want to talk to them about civilian 9/11 survivors who use Express Scripts and the debacle that this cost you have to go through. So I will be following up with you on that because they are unaware that that is an issue. So hang in there with me. We'll be working on that. Steve, look for the Medicare link. Hold on, if it's still on my screen, I will drop it in the chat for you. Yeah, so let me, just so you know, let me make this a little bit easier. For the Instagram people, if you are looking for the Medicare formulary, I'm dropping that here. That way you don't have to find it. Lieutenant Giuseppe, so do I ask the doctor to send my Ozempic prescription to Prime? I thought it would go automatically from Express to Prime. So Lieutenant Giuseppe on Instagram. So this is what this would do. They're supposed to, if you want your drug to be delivered, ask the doctor to send it to Prime Therapeutics, and you are Medicare, you would have to create an account to tell Prime Therapeutics whether or not you want Express Scripts to deliver it or not. If you can't just assume that it's going to happen that way. If you want it delivered, then that's yes. You have to create the account to tell them. And the prior authorization, know what? Are you Medicare or pre-Medicare? So Lieutenant Giuseppe, pre-Medicare, you do not have access to Express Scripts. Your only delivery method is through Amazon Prime. So if you want it delivered, you have to create a Prime Therapeutics account, or you can go through your Emblem portal, click the pharmacy tab, and then you can direct that drug to be delivered to you through Amazon Prime. And no, you do not need to have an Amazon account to get your drugs delivered, okay? But you cannot use Express Scripts pre-Medicare. Express Scripts is still only available to those on Medicare. You cannot, pre-Medicare active workers cannot no longer use that, okay? You're welcome. Okay, I'm going back over to this side. Here's, if I didn't put it, here is the actual link for the formulary for Medicare people. We're both Medicare. Thank you. Okay, so I just dropped the link in the chat on Facebook for you, Steve, and on YouTube. Sometimes Amazon leaves packages in the street outside the building. Oh my goodness. This would give me a heart attack. I don't think I could deal with that. No. I know I'm in the minority with DEA prescription coverage, but neither the DEA nor Capital RX, the new plan starts February 1st, can tell me anything at all about the coverage or when the cards will be sent. Anyone know anything? Gwen, I'm sorry I never got back to you this week. I will tell you that on Monday, you and I need to make a phone call and we need to do it together. So let me know what your availability looks like, because you and I must do this together. And they actually probably won't be open because it's Martin Luther King Day. So let's say on the 20th, I'm in the hospital that day for my infusion, but I can do this with you after 2 o'clock. So if Tuesday after 2 you are free, you and I could do that, make that call together, okay? Otherwise, probably the next day I can do that is Thursday, the 22nd. And so let me know what your schedule is like. Send me an email. You and I need to make this call together, okay? All right, great. I love the petition by Stop Charging Retirees. Thanks, Laura, for bringing that up. My apologies that I did forget. So for all of you that heard this story about the teachers, active and retired, once you're retired, and your UFT, and a couple of other unions do this as well, like CSA, the principals, corrections officers, corrections, COBA. There's a group of you that don't have access to this, right? So you don't have access to a free premium free plan. And so the teachers were like, wait a minute, we're sitting on over $1 billion in reserves in our welfare fund. Like, why can't we do this? Why can't our former union offer us a free drug plan like DC 37, like all these other unions? And so what we did was we wanted you to see that there's a group of teachers, active and retired, that are doing a petition, and anyone can sign this, anyone. And there's a place in here. Let me go back to that link. There's a place in here where you can sign this petition, and it doesn't matter whether you're a UFT retiree, active UFT, you're an other city union member or an other city union retiree, or just an ally. You believe that there should be a free plan, but you're not union. It doesn't matter where you're from. And so they wanted you to support their petitioning, their former union or union, to say, hey, we should have a free drug plan too, a premium free drug plan, rather than us paying for this. So this is their petition. I'm going to drop that link in the chat. Please support them. Oop, I'm sorry, I just put the wrong link in there. I think I just gave you the formulary again. Give me 1 second. For some reason, this keeps... let's see. I want to just do that. Will it let me? Yes, it does. Okay, I'm going to drop this chat in Instagram. My partner's membership number changed with Prime. Would it have also changed in Emblem? I don't know. The best way to check that one, though, is to log into your Emblem account, and you should be able to access your dependents' information and create accounts for them as well for Prime. But if not, if you don't see the answer to that, that would be a real easy call to Emblem Health to ask. But again, do it on Tuesday because Monday's a holiday. Which reminds me, our Facebook page will be closed for the holiday on Monday. So back to this here. Hold on, where did that go? There are several unions. Yes, that. Oops, did I miss that? I missed the first question. PS typo, left other job. John, I don't even see the first question. Oh, here it is. Leaving live update for dinner. Keep the ongoing fantastic. I love you, John. Have a great dinner. Kerry, yes, I'm a CSA retiree. Can we and the other unions be more prominently represented in this petition or elsewhere? So Kerry Weinbaum, that is a great question. Maybe we can work with the other retirees to petition their unions as well to give them a free drug plan, just like the majority of the other unions are already doing. But I will see what we can do about doing something like that. Don't let me forget this. But yes, that's a great idea. So let me scroll down a little bit more. Tuesday afternoon is good. I'll be out town Wednesday, Thursday. We'll measure. Thank you, Gwen. Okay. The way it's written, the petition highlights UFT only. Stop the UFT retirement penalty. What about the rest of us? So, Kerry, this is a UFT petition because they're petitioning the United Federation of Teachers. There would probably need to be another petition to do the CSA. Let me talk to the people running this one and seeing what we could do. So stay in touch with me. Can we fill out the UFT petition more than once? My fingers need exercise. And no, I don't think so. I think it's just once. It's not like before, but they just need to know that unless you have multiple personalities and you don't know them, I'm going to say no. Randick, adding to Ellen's response, your doctor does the heavy lifting on this. So I didn't see what you're answering back, Diana. If someone's asking about the prior auth that is for the physicians. Does this issue apply to DC 37? Nope, it does not, Edward. This does not apply to you on this issue of the drug plan. You are on DC 37 CVS Silver Script plan. This does not affect you. The discussion on this plan that we've been talking about is only for those on the Emblem Drug Rider. Well, now I'll be looking at OR's website. Sorry, Tina. But you'll always get it from us anyway. And we told them, for as much as I don't mind sharing the information with you, I believe it should come from an official source. And I should be able to say, look at this memo from OLR. Look at this memo from Emblem and OLR. Because unfortunately, it was really upsetting to hear that UFT and DC 37 are in on these meetings and they're not distributing the information to anybody. And that's prohibitive. So this is why it's really important that they learn to communicate with all of us, not just the big two or big three or the three men in the room, right? Hi, it's Ken Triolo again. Forgot local 237. Oh, that they don't provide you with they are providing you with a drug plan. Or Ken, honestly, I don't know what you're referring to, but if it's about the drug plan, I thought they were providing you with one. Combine 100 plus welfare funds, save enormous money on recurring administrative and capital expenses. And Matthew, the crazy thing on this is you'll hear some of the largest union leaders say, we could leverage the power of our unions all coming together to create one big NYC EPPO plan, but they won't do that with their drug plans. I mean, it's just hypocritical. Ellen, I thought prior auth and formulary exception were the same thing. I'm also OSA and I have the same concern. Randick, talk to Ellen. She's really smart. I'm going to let you continue that conversation. If anyone uses a Credo for specialty drugs, you must update your drug card info to reflect your new card through Prime Therapeutics instead of Express Scripts. I'm going to bring that issue to them as well, because if that's another FAQ that they need to know about, I will see if they put that on the FAQs. OSA doesn't offer a drug plan. Add a new petition. So Judy, thank you for reminding me. I did not remember. Thank you. And I should remember because Ellen tells me that all the time. Again, let OLR know that Amazon dump and run. Yes, I will. They trust me. They were shocked to hear that today. Trust me when I tell you, they want to fix that issue because they didn't like hearing me say that. Is Councilman Marte going to sponsor our bill? Yes. CSA Welfare Fund Administrator encouraged us to transition to the GHI high option rider. So, Annie, I disagree because they should have encouraged you to shop around drug prices. And they didn't, because you can get a drug plan on the Medicare marketplace for less expensive. The city's drug plan is $180 a month versus marketplace is either free or $35 or $45. You would absolutely know your drug cost from Medicare's website, and you could choose your plan. So I'm disappointed that they didn't tell you their options, that they just encourage you to do one transition into the city's plan. And that was wrong, because you can still purchase an outside plan if you don't have younger dependents, get the marketplace Medicare Part D plan, and still keep the 365 rider, which though, you could still do that, which they should have told you. Why no auto refills? That's another good question, Express Scripts. So I don't have an answer on that, but I will add that to my collection. Robert Anthony, I need pre-authorization from one of my meds, and 90-day supply through Express Scripts was $330. Now my cost is over $700. So Robert Anthony, again, in this type of a situation, I need you to send an email to the organization with your name and contact number, the drug and the dosage, and whether you're Medicare or pre-Medicare. And then I can help you with that question. But that's exactly what I need and how I need it. They actually did tell us to check out other drug options, but they didn't tell you how. I did a whole video on how to search for a Part D drug plan. Okay, guys, it's 6:30 and I'm exhausted. I'm going to call it a day. I am taking off tomorrow. I'm going to a car show with my Volkswagen bus and trying to relax my eyes because you can see I'm still watering as I've been on my laptop all day. Enjoy your weekend. It is a 3-day weekend, and I will see you on Tuesday. Brooklyn. There are auto refills on Express Scripts for most medications. It'd be interesting to find out why there isn't on theirs, though. That'd be an interesting question. Okay, so I'm calling it a night. You guys go get some rest too. Get off your laptops. Thank you for joining us. I appreciate you listening. And I want to thank Amy again for Amy Rundell again for being on our team and helping us bring the teacher perspective from the active teacher, pre-Medicare teachers onto our meeting. It was a great meeting. I do want to thank everyone for listening to us. Thank you for bringing us and trusting us to take care of the issues that you have and bringing them to their attention. Emblem's listening. OLR is listening to you. Okay. And they are working on trying to get your issues resolved. I did drop the links in the chat for the formulary. I will make sure the website is updated. And if you're still having a problem after Monday, after Monday or Tuesday, let us know so that we can bring that to their attention again. So I do want to let you know that when we spoke to Deputy Commissioner Claire Levitt today, she does want to make it clear that they are interested in hearing your feedback and they do want to fix these issues to streamline it for you. And Emblem was the same way. So have a great night, everyone. Thanks, Amy, for working with us today. We appreciate you being on our team. And thank you guys for supporting us for all the work that we are doing. You can still, if you're not getting our emails, please make sure you sign up on our account, nycretirees.org. Go onto our website. You can sign up for our emails, make a donation, log into your own account, keep all your information right there. If for some reason you stop getting an email from us, please email us and tell us, because when Bob or I get the emails, we look into why you're not getting our emails, especially if you set yourself up to get them. Okay, I'm going now. Have a great night, everyone. I love you. Have a great weekend, and I'll see you Tuesday.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way things are.